This is the final audio for 245, spring semester 2020. Obviously, we're online for at least, well, we've been online for about 6 or 7 weeks, roughly. This is the third week in April that I am making this tape, and so I guess it's been about 6 weeks. We have discussed many diagnostic categories and have talked some about the treatment of mental disorders. And we're going to talk a little bit on this brief audio on the practices associated with treatment. This relates to chapter 16 of the book entitled Mental Health Services, Legal and Ethical Issues. For example, psychologists and other mental health practitioners have a responsibility to intervene when a person is at risk of hurting self or others, contact the authorities, police, hospital, etc. This is referred to as duty to warn. This exceeds or supersedes confidentiality in a therapeutic relationship with someone, and even any other psychologist-client relationship that is professional, such as psych testing. It is advisable for psychologists to speak to these parameters of treatment. This duty to warn is one of them. Also, the psychologist who is doing clinical practice, should spell out some other parameters, including the fact that if a patient or client is thought to be hurting a child in any way, neglecting a child, that this also is there is a dictate or actually a mandate that they contact the authorities. This is because they are considered, the psychologist is considered a mandated reporter for child abuse or neglect. Psychologists are also expected to work in areas that they have training, clinical training and academic training in, if they're practitioners. This is referred to as working within an area of competence. Also, the expectation of the psychologist is that their relationship with a client or patient is just that, a relationship that is professional, that is not personal and professional. If it is personal and professional, this is considered a dual relationship. It is unethical if that is with a child and they are involved personally and professionally. With an adult, it would be perceived as unethical as well. With a child, actually unethical and illegal. With an adult, typically unethical, which is significant. I should also mention that the term psychologist is a regulated term. There's a governing body. You have to have a certain degree of education, pass certain tests, licensing exams in states such as Connecticut. But the term psychotherapist is an unregulated term. One can put out a shingle and call themselves that, and that is not illegal. It might be considered sort of morally unethical to do that if you have no training and you're considering yourself that, but it is an unregulated term and hence not illegal. Many master's level therapists, clinical social workers, maybe even marriage and family therapists, counselors, consider that, well, on their business card, call themselves licensed psychotherapists. Well, there is no such term. It's an unregulated term. The governing bodies, state educational boards do not license it. There is no test for it. So that is not illegal to do that, but certainly unethical. So just wanted to make some of these distinctions in this brief presentation that you'll need to know, go through and have some knowledge of, because on your final assignment, which is a non-cumulative final covering chapters 12 through 16, you'll be asked a few questions. And I will be posting that exam in the coming, I would say, week to 10 days toward the end of this month, April, or the very beginning of May. So look for it online. Look for it on Blackboard. Okay? If you have any questions, certainly you can email me only at wgrod, not my AOL, but I've run into problems with that, but my wgrodman, G-R-O-D as in David, M-A-N, at norwalk.edu. Take care. Bye-bye.